breast cancer is not a death sentence anymore. The important thing is actually to get the treatments done and to get them done completely at the first time. And with that, especially if you have early breast cancer, your outcome is going to be very good. One of the commonest things is that they all compare. You know, my cousin, my auntie, my grandmother had breast cancer and they died really young. Or they did their treatments and they still died. So the worst thing you can do is compare. Every cancer is different, every patient is different. And we have to tailor the treatments according to the type of cancer that you've got. But get information from good websites, okay? Sites that are actually scientific based. Don't opt out for traditional treatments because they are not scientifically developed, and therefore you cannot compare those treatments to the treatments that we have in our armamentarium, because these are all scientifically developed treatments. We don't give you a treatment out of our hat. We don't pull it out of our hat. We've done research for the last 100 years on breast cancer, and that's how we're telling you that this particular treatment is going to work for your particular cancer. The treatments that are out there that are not scientific are basically based on testimony, which means one person took it, one person got better, and then everybody wants to take that treatment. You know, they don't have to tell you about the 99 who died taking the same treatment. Okay, so this is why it's very important to keep a level head. As I said, don't panic, and then do your own research, but research things that are scientifically based. When you sit with your doctor, at the first onset, maybe it's not the best time because you'll still be in shock. Okay, so it's actually okay to take a little time out. Okay, go back and do a little bit of your research on your own, but don't read everything that's on Google. Unfortunately, that'll make you even more stressed. So the best thing is actually to sit again with your doctor, think about what questions you want to ask your doctor, and then have an interview with the doctor that will help you get through all the questions that are in your mind. If you come with an early cancer, and it's diagnosed in the early stages, and you do the proper treatments, you will most likely actually outlive the cancer. Okay, so surviving something like 20 or 30 years will actually be possible with an early breast cancer. Okay, the unfortunate thing is that a lot of the treatments are very expensive, especially the newer targeted therapies, and therefore you actually need to have very good insurance, or a good guarantee letter that will support all your treatments until you finish them. The primary treatment is usually surgery. You actually have to cut out the cancer, okay? And then you have adjuvant treatments or add-on treatments. These, of course, will be like chemotherapy, radiotherapy, hormonal treatment, and nowadays we have targeted therapies as well, or immunotherapies, okay? And all these treatments will depend upon the type of cancer you have. So by the time you've got your result that you have cancer, you would have already had your biopsy. So the treatments are actually now very personalized. We look at there are different types of cancer, and we treat it according to, we call it the immunohistochemistry, or basically the face of the cancer. You actually have cancers that are good cancers, which means that they're non-aggressive ones, and you have cancers that are very aggressive. The younger you get cancer, it means that your cells have made a mistake. Your genes have made a mistake, and therefore the cancer cell has developed. And usually then what happens is that your own immunity cannot control this cancer cell and allows it to grow, cannot recognize it and allows it to grow. So if you think about getting a cancer early, means your systems, your genes and the suppressor genes that you have failed at a younger age, which means that in all likelihood it's going to be a more aggressive cancer. Whereas if you get cancer after 60, your genes have worked wonderfully and your immunity has worked wonderfully for 60 over years. And then when you get cancer, it's usually because you're aging. Okay, the younger women sometimes have a genetic defect that then brings up the cancer very young. And unfortunately, again, those are the more aggressive types of cancer. I always encourage second opinions, but it's good to go to somebody who knows what they're talking about. So there are quite a few breast surgeons in the Klang Valley. Unfortunately, outside of the Klang Valley, there aren't that many, but they still are available. Okay, in the big towns, of course, Penang, Ipoh, JB, even in East Malaysia, we have them, but they're not so readily available. So therefore, it will be good to get a second opinion if you can. It's always good to ask your doctor for a second opinion. I'm very happy to tell my patients who else to see to get a second opinion, because then, you know, when we're all singing the same song, then you also feel more reassured that you're getting the right treatment. Yes, there are quite a few support groups, peer support groups. Okay, one of the ones that come to mind for us is Breast Cancer Welfare Association, or BCWA. We work very closely with them. Before the lockdown, their counsellors used to actually come and talk to our patients in the ward, just to, you know, give them a sort of an insight into what treatments are to be expected, what they can go through, because they're speaking from the patient's point of view. You know, if you and I talk to them, it's always because we've got all this information and then we talk to them. But when a patient or a survivor talks to you about the cancer, it makes a whole lot more different, you know. So they used to come and actually counsel. They now do video counseling with our patients, and they have a whole load of series of YouTube channel videos that allow you to actually do it in your own time, you know, to get more information about breast cancer.